watching News 8 on WROC.
Joining us now is Barb Lucke, a lactation consultant for Highland Hospital. Barb, thank you so much for being with us.
Thanks for having me.
This week is World Breastfeeding Week. Let's start with this question. What are some of the benefits of breastfeeding for parents and babies?
Well, breastfeeding provides newborns with optimal nutrition, including antibodies that really enhance their immune system over the whole duration of the time that they're breastfeeding and beyond. So we see with breastfed babies that they have much less infections, they have lower rates of obesity, and even lower rates of sudden infant death syndrome. And the moms also reap some benefits as well that continue over the course of her life. We see lower rates of cardiovascular disease in mothers who breastfeed, lower rates of diabetes, and even some lower rates of breast and ovarian cancer.
Now, the American Academy of Pediatrics recently came out with new guidance that recommends breastfeeding for 2 years or longer. Now, 2 years of breastfeeding might seem like a daunting task for a lot of parents, but what does this recommendation really mean?
Well, I think the American Academy of Pediatrics is now trying to align with the World Health Organization, which has pretty much always said that children should be breastfed for up to 2 years. And now remember that when a toddler, so a child between 1 and 2, is still breastfeeding, most of their nutrition at that point is really coming from their table food consumption. And just a small little supplemental nutrition is added with that breastfeeding. And they're busy as toddlers, so they're not breastfeeding a ton. You know, it might be like 2 or 3 times for a very short period of time, maybe before nap and before bed. So I don't want parents to think like the intensity of breastfeeding in the first 6 months should be compared to what it's like to continue to breastfeed a 1 to 2 year old.
Awesome. Okay. And what are some of the obstacles that parents might be facing, kind of going off of that, in achieving 2 years?
Well, I would say the biggest obstacle is navigating work-life balance and breastfeeding. And I think if we really want to achieve a goal of having families ponder and be successful at breastfeeding for that duration, we're going to have some significant policy changes around extending our universal paid maternity leave. A lot of the countries that are successful at getting children to breastfeed longer, they're giving their families a paid 6 months of leave.
Sure. Barb, my last question for you. What resources are available for parents who are looking to extend their breastfeeding journey, might need help along the way?
Well, remember that your pediatricians often have lactation support, so that's a great place to start. WIC also offers peer support and group support, as well as food subsidy support for breastfeeding.
Awesome, Barb. Thank you so much for your time. We'll have a list of those resources for you over at rochesterfirst.com. Thank you again, Barb, for being with us.